One of the people who died had underlying health conditions. This brings the total number of deaths to 24,566 in Los Angeles County. We share our deepest condolences with those of you who have lost friends, loved ones, and families during this difficult time. We are reporting 1,537 new cases today, an 83% increase over the last week, which brings the total number of cases in LA County to 1,262,578. There are 406 people currently hospitalized with COVID-19, an increase of 30 people over the past week. That's actually over the past day. Over the past week, it's been about 130. There are currently 63 open investigations at residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. To date, more than 7.1 million people have tested and had test results reported in LA County. Our daily test positivity rate is 3.75%, an increase from a rate of 1.2% on June 15th when physical distancing restrictions and capacity limits were lifted across all sectors. Our daily average case rate with a 7-day lag is now 7.1 per 100,000 people, also an increase from last week's case rate of 4.8 cases per 100,000. Again, according to the CDC, this daily increase in cases to the high level where we are now puts us in the category of substantial community transmission of COVID-19. And considering that we've reported over 1,000 new cases a day over the last 7 days, this average case rate is at a substantial community transmission level, even without a 7-day lag. Next slide. For this reason, we will be implementing an order requiring masking indoors, regardless of vaccination, that will go into effect at 11:59 on Saturday, July 17th. Wearing a mask when indoors with others reduces the risk of both getting and transmitting the virus. Masking indoors must again become a normal practice by all, regardless of vaccination status, so that we can stop the trends and level of transmission we're currently seeing. Some exceptions will apply, and this will be similar to masking requirements that were in place prior to June 15th. We expect to keep this order in place until we begin to see improvements in our community transmission of COVID-19, but waiting for us to be at a high community transmission level before making a change would be too late. Next slide, please. This graph shows trend lines in cases, hospitalizations, and deaths in our county from March 1st through July 7th of this year. Over the last few weeks, we've seen a rapid and sustained increase in the number of new cases reported each day, in addition to a continued slow increase in hospitalizations. Deaths continue to be relatively low, but as hospitalizations increase, deaths may also begin to increase. Next slide, please. Becoming fully vaccinated against COVID-19 remains the best protective action that people can take if they're eligible for it. Although not 100% effective, it substantially reduces the risk of infection and, for the small number of people that get infected, of hospitalization and death once you're fully vaccinated against COVID-19. And we urge all residents to get vaccinated in order to protect themselves and their family and friends. This slide focuses on the trend in case rate by vaccination status between May 1st and July 3rd of this year. I want to note that these numbers were obtained by looking at vaccination status among people who had tested positive for COVID-19 over the time period indicated. As you can see, this reality has been and is still being driven, this pandemic rather, is still being driven by unvaccinated people, represented by the orange line. As cases begin to rise in early June, you can follow the orange line to see that the case rate slowly among unvaccinated people through the week or so of June followed a steep incline beginning last week, in the last week of June, rather. On the green line towards the bottom of the chart, representing the case rate among fully vaccinated people, you see the transmission remaining steady almost through the third week of June, then begin to slightly rise thereafter. You'll note that the rate of rise in vaccinated people among those testing positive is slower than the rate of rise in unvaccinated people. And that based on these rates, as of July 3rd, unvaccinated individuals have 5.1 times higher risk of COVID-19 as compared to vaccinated people. I want to note that we do expect to see case rates among vaccinated people increase as vaccination coverage increases. That's because a larger proportion of our population, as they become vaccinated with time, even with a small proportion of fully vaccinated people getting infected, if you have a small number or proportion of them, and it's a small number, it's going to be small. But as the number of vaccinated people increases, then the number of vaccinated people with infections will also increase. It's just related to there being more people vaccinated. As an example, randomly choosing 5%. 5% of 100 is small, while 5% of 1 million is not, but it's still 5%. Next slide, please. Again, the best collective action that each of us can take is to get vaccinated against COVID-19, if you're eligible, and to consistently take sensible precautions, especially if you're not eligible or choose not to be vaccinated. This slide is a comparison of case and hospitalization rates by race and ethnicity from the 2-week period ending on June 5th, alongside the same metrics a month later for the 2-week period ending on July 3rd. You'll also see the percent of the population 16 years or older by race ethnicity who have received at least one dose of vaccine through July 11th of this year. As we have reported previously, over the month preceding July 3rd, all groups have seen an increase in cases, with the highest rate observed among Black residents, whose case rate increased from 40 cases per 100,000 to 97 cases per 100,000 people, an increase of 143%. We've also seen increases of 81% in Latinx residents, 129% in white residents, and 183% in Asian residents. Over the same interval, while hospitalization rates decreased by 6% among white residents, these rates have been trending upward by 10 to 50% in Black, Latinx, and Asian residents. As mentioned on June 15th, the risk of infection with and severe illness from COVID-19 remains highest among those who are not vaccinated. We are unfortunately seeing this play out here in Los Angeles County, across both the state and our nation, and in other countries in the world. When we look at the group with the lowest percentage of vaccinated population with at least one dose, those vaccinated with at least one dose in our Black population, we see the highest case and hospitalization rates. And for the group with the highest percent of population vaccinated with at least one dose, our Asian population, we see the lowest case and hospitalization rates. Next slide, please. We believe that with the recent rise in cases, tracking the proliferation of variants of concern remains a priority as we seek to better understand the factors that may be contributing to increased community transmission. We're especially concerned about the Delta variant of the virus because it's more easily spread between people, more than other variants of concern. And while emerging data confirms that fully vaccinated people are well protected from severe infections or illness with Delta variants, people with only one vaccine of a 2-vaccine dose are not as well protected. And there's still evidence that a very small number of fully vaccinated individuals can become infected and may be able to transmit to others. This slide shows the variants identified by both the Public Health Lab and a group of other California laboratories from 7,737 specimens linked to LA County residents. Delta variants are represented in the bright yellow in the bars on this chart. We started seeing small numbers of these cases among LA County residents in early April, and we continue to see an increase in Delta variants as a proportion of the variants of concern attained by sequencing. As you can see on this chart, the Delta variant has been the most commonly sequenced variant in LA County since the beginning of June, now accounting for the majority of variants of concern identified by the labs. Next slide, please. This trend line shows the trajectory of the Delta variant among specimens sequenced by several labs serving Southern California, including our LA County Public Health Lab. The number of sequences collected between June 27th and July 3rd that had Delta variants isolated was 124, 71% of all sequences collected that week. This is represented by the blue trend line on this table. Given that slightly under 4 million LA County residents are not vaccinated, the risk of increased spread of this variant within our county remains high. Next slide, please. One of the fears some have about the Delta variant is that fully vaccinated people will not be as protected from infection with these variants as they are against other variants of COVID-19. This slide compares the vaccination status of LA County residents among those whose samples yielded any of the top three or four variants during the month of June. The most compelling information from this slide is how very few people who are fully vaccinated are infected by the variants. This is true even though fully vaccinated people are more likely to have their specimens sequenced than those who are unvaccinated. It is also important to note that overall, the proportion of post-vaccination infections, those who were vaccinated more than 14 days after the last dose, the infections that were identified, were similar across variant types. Among the people whose samples yielded COVID-19 Delta variants, about 14% were fully vaccinated, compared with 9% of Alpha, previously called UK variants, 8% of Gamma variants, previously called Brazil variants, and 11% of all other variants. The differences among these percentages are still too small to be statistically significant and do not suggest large differences in the risk of these variants pose in terms of fully vaccinated people. And as you'll also take away from this slide, the vast majority of those individuals who were infected are unvaccinated or not fully vaccinated. We'll take the next slide, please. Again, it's increasingly clear that COVID-19 vaccines remain one of our most effective tools for keeping the spread and impact of this virus low. And we continue making progress on providing vaccinations. As of July 11th, we have administered more than 10.7 million doses of vaccine in the county, including more than 5.9 million first doses and more than 4.7 million second doses. This means more than 5.7 million LA County residents have received one dose and more than 5 million are fully vaccinated. Among LA County residents 16 and over, 69% have received one dose of vaccine and 61% are fully vaccinated. Among seniors 65 and older, 88% have received one dose of vaccine and 78% are fully vaccinated. Next slide, please. We thank the millions of residents that have made the decision and been vaccinated. We continue to see fewer folks than we'd like to see getting their first dose of vaccine week to week. And as you can see, the vaccination trends on this slide, between July 7th and 11th, we administered 52,744 doses across the entire county network. As there is currently substantial community transmission of COVID-19 here in LA County and in our nation, the urgency to get more people vaccinated remains high. Next slide, please. Although it's disappointing that overall vaccination numbers are lower than we need them to be, there are continued increases in vaccinations among younger groups. As of July 11th, 41% of our 12 to 15-year-olds have received at least one vaccine, as have 55% of our 16 to 17-year-olds. Meanwhile, vaccinations in 18 to 29-year-olds rose to 58%, and the percent of 30 to 49-year-olds vaccinated rose to 66%. Although most people who get a first dose get their second dose on time, nearly 10% of LA County residents who received the first dose were 35 days or more overdue for their second dose as of July 4th. This proportion has remained steady over the past few months. Being fully vaccinated is better protection than being partially vaccinated. In one lab study, one dose of vaccine of a two-dose series barely inhibited a Delta variant of the virus, while two doses almost completely inhibited it. And although people do commonly report side effects lasting a day or so related to the vaccine, these side effects go away by themselves or with over-the-counter medications and these people are not contagious. They're also much less severe than the effects of the virus itself. So in comparison, getting vaccinated is much better and safer. So if you have only one dose of the vaccine, please don't feel falsely reassured that you have full protection from this virus. Please come back in and get your second dose so you can feel secure that you are protected. We are happy to answer all your questions about vaccine safety and side effects when you come back, and we want you to feel as good about getting your second dose as we feel about helping you get it. Next slide, please. On this chart, you see seven-day cumulative case rates per 100,000 for the 5 age groups with the highest case rates. As you can see, cases are highest and rising fastest in adults 18 to 29, represented by the green line, followed by adults 30 to 49, represented by the orange line. There are also rising cases in children aged 12 to 17 and ages 0 to 11, represented by the yellow and purple lines, respectively. This is a different dynamic than we were seeing earlier in the pandemic, when transmission was highest among older adults. Instead, we're now seeing cases in younger adults and in children rising together. Children don't live alone. Many households in the county contain both children and adults between 18 and 49. And we recommend vaccination in adults. When we recommend that, we do so in part to protect the children in their household who cannot be vaccinated. And when we advise for the vaccination of children 12 and older, we do so in part to protect the adults in their household and their playmates that are not eligible to be vaccinated. Next slide, please. Earlier, I showed you data showing that we are seeing a rise in cases and hospitalization, disproportionately affecting people across different races and ethnicities. While we are seeing low vaccination rates in the communities where transmission is rising fastest, this slide shows you in a bit more detail how vaccination is progressing within these communities. Vaccination rates in Black, Latinx, and American Indian and Alaskan Native residents have risen by 5 to 5.5% over the past month. While these rates have risen more slowly, at a relative increase of 2.3 to 2.8% among white and Asian residents. I want to note that while we have seen high percentages of vaccination among our Native Hawaiian Pacific Islander adults, the numbers in this group listed as vaccinated are an overestimate, and their percents vaccinated are therefore also overestimates. This is slower progress than we'd like to see, and is why we are so focused on improving access to high quality information about the vaccine and access to vaccination within these communities. Next slide, please. In general, more people are getting vaccinated across all groups every day, and we thank them for that. And we continue to be extraordinarily grateful for all our partnerships and the deep commitment on the part of so many to support vaccination efforts. As we look at age subgroups by race ethnicity, as seen on this slide, we continue to see gaps among teens and younger adults that we have seen over the past weeks. Among both 12 to 15 and the 16 to 17 age groups, between 1/3 and 2/3 as many Black and Latinx teens are getting vaccinated as their American Indian, Alaska Native, white, and Asian counterparts. The data also shows significant gaps among adults 18 to 29, 29% of Black adults in this category and 43% of Latinx adults have been vaccinated, compared with 59% of their white and 77% of their Asian counterparts, between 1/2 and 2/3 fewer. The disproportionality also persists among our 30 to 49-year-olds. In this group, 2/3 to almost 1/2 as many Black adults have been vaccinated as their Asian and white counterparts. It is particularly worrisome to see persistent gaps among the young and middle-aged adults, who are such an important part of our workforce. Continuing to provide accurate information about the vaccines, ensuring vaccinations are widely available, and continuing to recommend sensible actions to protect those not vaccinated remains our highest priorities. Next slide, please. To close, we need to make it as easy as possible to close the gaps. We need to make it as easy as possible for eligible LA County residents to get vaccinated. And we continue to offer many different vaccines at many different sites across the county. As you can see on this map, this week, there are 771 sites offering vaccinations, including pharmacies, clinics, community sites, and hospitals. You can see that many of our vaccination sites are concentrated in the areas that have been hard hit by the pandemic. And as a reminder, you can obtain vaccines at county-run sites, all the LA City-run sites, almost all mobile sites, and many community sites without an appointment. Many sites are also open on weekends and have evening hours. Please check vaccinatelacounty.com, again, vaccinatelacounty.com, to find a site near you. Next slide, please. We've continued with our strategy for improving access to vaccines by having mobile vaccination teams take vaccines into neighborhoods to reach people who have a limited ability or time to get to one of our established vaccination sites. The blue markers on this map indicate the 286 sites where mobile teams will be offering vaccinations this week, which are concentrated in these higher need, harder hit communities. The mobile vaccine teams are working with employers and community organizations to provide vaccines and information about them at convenient locations where residents gather. There is a form on the website to request a mobile team, and we encourage employers and event organizers to let us know when they want to host a team. We have sites set up at retail stores, parks, recreation centers, and many other gathering places all over the county to make it as easy as possible for residents to get vaccinated. Next slide, please. I want to make you aware of a pilot we're rolling out and one we've continued to get vaccines into the neighborhoods where they're needed most. First, we're piloting a project that in other contexts has been called ring or halo vaccination. The purpose of this project is to vaccinate close contacts once they're identified, as well as others who are contacts of those contacts. As you can see in the image to the right of the chart, this forms a ring of protected individuals around the contacts of the infected person, with the aim of preventing spread of infection beyond the circle of contacts. The way this works in LA County is once contacts are identified during the case investigation process, a member of our team reaches out to their contacts to do contact tracing and to offer them a home visit by a nurse who can vaccinate on site at the contact's residence. We began the pilot of this effort last Friday in East Los Angeles in Service Planning Area 4, where, as you know, there are several neighborhoods that have been hardest hit by the pandemic. If we find that the strategy works, we'd likely expand to Service Planning Area 6 and 1, where low vaccination rates still remain. We're also continuing to provide gift cards for completing case investigation interviews to help with contact tracing and going into the field to do interviews with cases. We've also have ongoing partnerships with Parks After Dark, McDonald's, YMCAs, and other sites to bring vaccinations to community events. And our priority continues to be those communities with lowest vaccination rates and those hardest hit by the pandemic. Next slide, please. Of the metrics we watch very closely to help understand the impact of Delta and other variants is the proportion of fully vaccinated people who test positive for, are hospitalized for, and tragically pass away due to COVID-19. This graphic, which has been previously shown, presents these numbers in LA County. Please note that the circles here are not to scale. We look at positive tests in the group of more than 4.7 million LA County residents who achieved full vaccination status from the time we began vaccinating in December through July 13th. Among these fully vaccinated people, we identified 4,122 people who tested positive for COVID-19 contracted more than 2 weeks after they were fully vaccinated. I want to note that this is an increase of 46% from the approximately 2,800 post-vaccination cases we had detected last week. This new number translates to 0.09% of fully vaccinated people who tested positive, up from last week of 0.06%. The rise in hospitalizations among fully vaccinated people was much smaller, from 195 to 213. That is from 0.04 to 0.0045%. Again, 0.004 to 0.0045% of all fully vaccinated people. And deaths in this group also increased less dramatically, from 21 to 26, from 0.0004 to 0.0005%. What's important to note about these numbers is that they're still much lower than the numbers in people who are unvaccinated or not fully vaccinated. Recall the trend lines I showed you earlier. The number of unvaccinated people who were infected with COVID as of early July was more than 5 times higher than the number of vaccinated people. We'll continue to monitor this data as time goes by. Next slide, please. The state recently released guidance for K through 12 schools requiring that everyone inside schools wear a face covering or a face mask. This requirement aligns with what we know about keeping school children safe. When everyone in school wears a mask, both adults and the kids in the schools have much lower COVID-19 transmission than they do in the community outside of the school. But it's important to protect children before school starts and outside of school hours. While children generally are less likely to suffer severe outcomes of COVID-19, the risk of COVID-19 related hospitalization and death in youth is not zero. And furthermore, preventing transmission among children prevents transmission from children to the adults they live with at home. Next slide, please. And while requiring masks in schools is an excellent way to prevent transmission or reduce the risk of transmission among children, now is a great time to plan to vaccinate your children who are 12 and older before the school year starts. I want to remind you that for now, only Pfizer vaccine is approved for use in children aged 12 and older. Additionally, the first and second doses of this vaccine need to be given 3 weeks apart. A person is not considered fully vaccinated until 2 weeks after the second vaccine. If you got your teen vaccinated with their first Pfizer vaccine today, they would be able to get their second dose of vaccine on August 5th and would be fully protected or fully vaccinated as of August 19th. Vaccinating your children now would add an extra layer of protection only a few days after many schools reopen. We're hearing more and more from teens that they want to be part of the solution to this pandemic. You can help them take part in protecting their friends, families, and teachers by getting vaccinated well before the school year starts. Next slide, please. Because we're grateful, so grateful to everyone who does their part to protect themselves and their communities, we continue to extend thank you gifts to residents who come in to get vaccinated. I want to express my gratitude to the many partners who work so hard to improve vaccination coverage in our community or in our counties. We appreciate the support of our sports teams, event venues, and local attractions in helping to encourage those not yet vaccinated to get informed and get vaccinated. Beginning tomorrow through next Thursday at county-run sites, LA City sites, and St. John's Well Child and Family Center sites, everyone 18 years and older coming in to get a vaccine will have an opportunity to win one of 7 packages of tickets to Family Fun at the Staples Center, including performances by the Harlem Globetrotters and Disney on Ice, and the Gold Over America Tour starring Simone Biles. We greatly appreciate the generosity of our partners at the Staples Center. With their support, 7 lucky people and a whole lot of their friends will get to enjoy both a protection by the vaccine and a thrilling show at a terrific LA County venue. See official rules on the county's website for details. Over the next week, please make time to get your vaccine. Thank you, and I'll take questions.
Thank you, Dr. Davis. We will now take your questions. If you have a question, please make sure to raise your hand using the hand icon, or you may chat me, the host, and submit your question. Our first question comes from Patrick Healy. Patrick, let me unmute you. You are unmuted. Please ask your question.
Hi, thank you much. Hello, Dr. Davis. Rough day. Given these increases that include the 0 to group, do we reconsider inviting school children under age 12 back to in-person classes? Or at the very least, do we consider restoring distancing and some other precautions in addition to the masking? Thank you.
I appreciate that. I think, Patrick, things can continue as planned. Every layer that is added, inside of the school setting, on top of vaccinations for those who can be vaccinated, does help. We'll continue to watch as schools start, but I think with the current plan, I think, hopefully things will continue to be okay. But again, we encourage those who can be vaccinated to add that additional layer of protection. Thank you.
Thank you. Our next question comes from Ron Lynn. Ron, you are unmuted. Go ahead.
Hi, Dr. Davis. Thanks so much for taking our questions. Super appreciate it. We have 3 questions for you today. First, in the past, there's been this debate on emphasis on whether vaccinated people need to be masked. Dr. Fauci has emphasized that they don't, but he's also mentioned that when case rates are high, vaccinated people might want to voluntarily wear masks to reduce the threat of breakthrough infections. First, is this where LA County is right now? In other words, when vaccinated people mask up, are we protecting ourselves against the chance of breakthrough infections and transmitting the virus to other people? The second question is, is when you were talking about COVID among fully vaccinated people in LA County, and there was this very small increase in the number of fully vaccinated people contracting the virus. Are you worried that there's an increased risk of breakthrough infections with the Delta variant, or do you think it's just basically float? And then finally, do you think there might be a need for further restrictions, like reducing business capacity or physical distancing, or even business closures, or do you think that's off the table? Thanks so much.
Thank you. I appreciate that. So let's go to the last question, because I'm sure that's the question that most people want to hear about. I think as this has been a very dynamic situation, and as we looked at these increases, we looked at what would be helpful and we know is helpful, and that would also not limit businesses in terms of their operations. And this is one of the things that can be done. It is one thing that we have strongly recommended, even after June 15th, in order to add that additional layer of protection when there weren't going to be the physical distancing limits and capacity limits inside of businesses. So I think, everything is on the table, if things continue to get worse, which is why we want to take action now, given that we're at this level of substantial transmission. The next level is high transmission, and that's not a place where we want to be. Our hope is that with continued vaccination of people, as well as with masking by everyone indoors, which is much easier and universal and makes this a normal practice again, that we won't see continued increases in cases, and we'll start to see lower numbers in terms of the cases. So really, this is probably the one of the more effective as well as the least limiting in terms of business operations. In thinking about masking and requiring it for everybody indoors, we can go back to just think about when there was this change and there's vaccinated people, not wearing masks, and those who are unvaccinated being required to wear masks, and it just becomes hard, in that instance. And I don't think in general that self-attestation is actually good in that, and there may be some people who are unvaccinated and don't want to make that known that they're unvaccinated and go without, and that just puts others at risk. But I think in general, our concern is not as much for fully vaccinated people, although we are continuing to watch this Delta variant and what it's doing. And it really is about making this a universal practice. It's the easiest thing to do in terms of ensuring that we're all protected, regardless of the risk that we have. But it just normalizes the practice and then adds that additional layer of protection. Again, we're at a substantial level of community transmission, and we can't wait for this to go higher to think about acting differently. Once we're at a higher level, that will be too late. In terms of masking for people who are fully vaccinated, yes, it adds another level of protection. I don't know that it's significant when we look at the percentage of Delta variants cases identified in the sequencing. I believe it was 11% when we reported before, and now it's 14%. I don't know that that's significant, but it is something to continue to look at. In general, as we've looked at this, again, across all of these, there is pretty good protection, significant in terms of protection against the virus. But if you are going to be infected, adding a mask will help reduce that risk as well. Thank you.
Thank you so much. Our next question comes from Claudia Pachuta. Claudia, you're unmuted. Please go ahead.
Thank you. I also have 3 questions. So I noticed the positivity rate among fully vaccinated people is going up, but the numbers are so small. Can you talk about what we should make of that? And then you note that there doesn't seem to be a significant increase in breakthrough cases related to the Delta variant. So why make fully vaccinated people mask up now? And I know you've touched on some of that, but if you could talk about it directly in relation to Delta. And overall, the numbers are relatively low compared to the winter surge. Would you call what's happening in LA County now a surge, given that the increases are speeding up? And given all the people who are vaccinated, do you think at some point these increases hit a wall And when might they do that? Thank you.
Thank you, Claudia. I think I got all of them. In terms of as vaccinations will increase, based on what we see in terms of the comparisons for people who are not vaccinated and those who are vaccinated, these numbers should start to go down. That would be an indication of community immunity if these cases on the daily basis are much lower in terms of what we're seeing. So that is what we're looking at in terms of seeing the impact of vaccinations. And again, you have to remember that this is largely being driven by those who are not vaccinated. So I don't want to, I want to underscore that. In terms of thinking about this as a surge, it's an increase. It is not where we were before. So I don't know what you would define a surge as, but in either case, the increases have been substantial over a short period of time. And again, we were at a low level of community transmission when we entered into reopening, and now we're up to a substantial level based on CDC standards in terms of community transmission. But again, this is not dissimilar from what we're seeing across the nation. Again, the nation appears to be at a substantial level of transmission according to the CDC's website. In terms of masking by all, there's a couple of ways to go about masking. And I think masking by all, just as a general practice, makes it a lot easier for this to happen, and at the same time provides an additional layer of protection for those who are not vaccinated, as well as those who are fully vaccinated, even though there's a small number of them who may be infected regardless of being vaccinated. Again, the relative difference between those two is very small in terms of the number of people that would actually be infected. However, masking by all just makes it a level playing field. There's no confusion. It's much easier. And I don't think any business wants to say, I really can go through and figure out, the vaccination status of everybody. I can verify that. But in either case, this just makes it much easier. It's pretty clear for everybody. Everybody needs a mask regardless of vaccination. In terms of the positivity rate and looking at infections in fully vaccinated people, again, I mentioned that it will start to go up just because the numbers start to get larger and the vaccines aren't 100% effective, but they are very effective and have been shown to reduce the risk of infection. But they're definitely, consistently been very strong as well on if you were infected to reduce hospitalization and death from the infection. So I don't make a ton of it just in terms of looking at it, but we will continue to watch, if we hopefully not, get some other variant and we start to see more and more breakthrough infections as we look with our state and with the CDC to make a determination on, the effectiveness or continued effectiveness of the vaccines, then we'll talk about that in a different way. But at this point, I don't make a lot of what we're seeing in terms of fully vaccinated people. But again, everyone masking makes it a lot easier to implement, and it does add that additional layer of protection even for those who are fully vaccinated. Thank you.
Thank you so much. Next is Marla Tellez. Marla, you're unmuted. Please go ahead.
Hello, Dr. Davis. Just wanted to touch on the enforcement issue again. I know this is not the first time that we've experienced this. I can imagine there's going to be a lot of frustrated vaccinated people who, as Claudia was alluding to, we got vaccinated for a reason. So here we have to wear this mask again. So how do you foresee enforcement this time around? And then just a clarification question, and that is how long does this health officer order last? What will it take to get back to maskless?
Appreciate that, Marla. So, we've heard a lot that people, got vaccinated so they didn't have to wear the mask. And, I can appreciate that, whatever your reason was. What I'm thankful for is that you got vaccinated. You're much less likely to get infected, but you still can be. And if you are infected, you're not as likely to end up in the hospital or die from the vaccine, not from the vaccine, but from the virus. So I think, this is an all hands on deck moment. We have substantial level of community transmission. We're only one level below a high level of community transmission. And we all need to do our part, make it as easy as possible to just, to try to put some other measures in place to try to prevent having the need for anything else in order to reduce what we're seeing currently. Again, this is not a place that we wanted to be. Again, this is something that we recommended, especially when businesses weren't going to be checking or verifying vaccination status. We've heard from lots of businesses, saying that, we wished you would have just kept it in place. It would have made it a lot easier. It's something we want to do, but, we're a business and, sometimes this impacts our ability to do, our operations in that way. So this just levels the playing field. It does provide protection for everyone on top of being vaccinated and whether you're not vaccinated. And so this is, a way to think about it. This is an all hands on deck moment. We're seeing, the rates go up too high at the moment, and we don't want them to go higher. Your second question in terms of your first question in terms of enforcement, this is something that we will continue to have to look at, but at least there's a clear, bright line in terms of what needs to be done. This is an everybody moment in terms of wearing your mask and indoors. And it's something we'll, continue to look at and see how things go. But in general, from what we've heard from businesses, it's easier and better for us to do this. And it's much easier for people to understand in terms of where they need to mask. In indoor public settings, businesses, you need to mask up.
Thank you so much. Our next question comes from Steve Gregory. Steve, you're unmuted. Go ahead.
Thank you very much. Good afternoon, Dr. Davis. Actually, I want to go back to my colleague Marla's question. Can you be more specific about enforcement? Because you had inspectors out there in full force giving out citations and whatnot. Do you plan on enforcing this health order with restaurants and retail shops and other indoor venues? And also, are you folks ready for the backlash? I mean, it seems like things just started to calm down. And, you've already kind of touched on all the other reasons that, you were asking them to get vaccinated for various reasons. But the issue is people are fatigued. Are you ready for this? And are you ready for these fights that you see on social media constantly? And how do you plan on enforcing this? And are you ready for the pushback?
We've been through a lot, in terms of this pandemic. It's been very dynamic and very hard to predict. We took a chance in terms of, lifting as a state, in terms of lifting the physical distancing requirements as well as the capacity limits. We changed the masking at the time. We felt it was reasonable to do given the level of community transmission that we had at that moment. But this is not the same situation. We're in a very different situation. This is not the same as what it was June 15th. You can see we have, over 1,500 cases today. We've been at over 1,000 new cases for the past 7 days. So this is not the same situation, and it does require different action. And this is really something that each and every one of us has an impact on. Every case that happens is a person who was infected and in contact with someone else. It's not something that, really is, I just got infected and it's going to stay with me. If you're a hermit and you don't go out and talk to anybody, then maybe. But you had to be in contact in some way with someone else. So this is person to person. We have, everyone needs to do their part in this regard. We have to get these numbers down. This is not the same situation as it was June 15th. In terms of enforcement, we, have done this in the past. We'll continue to go out and educate. It's not something we really want to have to do in terms of giving citations. We really do need to get these numbers down. Otherwise, we're going to end up in a situation where more strict measures have to be put in place. It's not a place that we want to be. So we really just want people to go along, get this together, because it's going to take all of us to do our parts in order to lower what we're seeing right now. Again, we were at low level, now we're at substantial. The only next level is high. We have to do something now.
Thank you very much. Our next question comes from David Singer, and he doesn't have a microphone. So his question is, how will the mask mandate affect indoor restaurants and restaurants?
So I appreciate that question. To be clear, can you still go out and eat dinner? Yes, you can. If you're sitting and waiting to be seated and you're not eating, keep your mask on. But otherwise, you can eat and drink as you have, because you have to take off your mask to do that. But otherwise, keep your mask on in order to reduce the chance that if you were unknowingly infected or someone around you was, in an indoor setting where the risk is higher, it's transmitted through the air and can concentrate indoors, especially in places where the ventilation is not good, then you keep your mask on. But otherwise, eat and drink as you normally would, but when you're not doing that and you're waiting indoors, keep your mask on.
Thank you very much. Our next question comes from Matthew Slade. Matthew, you're unmuted. Please go ahead.
Yeah, hi, Dr. Davis. I had a question regarding one dose recipients of the Johnson & Johnson vaccine. I've been reading some stuff about potential advice to get other doses of different vaccines to increase protection. Have you heard anything about this? Is there anything on your end that you've heard regarding this question?
No, and this question has come up a lot. We haven't gotten anything in relationship to that's needed. And the CDC has also said, there's no recommendation once you're fully vaccinated with any one of the three vaccines that are authorized for emergency use in the U.S., that there's no need to get an additional one. Although we have heard that people have. It's not something that's been studied. We don't know if there's an increased risk or some other side effects that could come from that, or whether or not there's documented improvement. I think there were some studies in the UK related to it, but it's not something that has come to fruition in terms of leading to a recommendation to be vaccinated with another COVID-19 vaccine. So at the moment, the recommendations are pick one, get fully vaccinated, and then continue to take precautions as mentioned today.
Thank you. And our final question will come from Nancy Kaufman. Nancy, you're unmuted. Go ahead.
Okay, thank you so much. I really appreciate it. And thank you so much, Dr. Davis. I have a couple of questions. They may overlap. One of my questions is that how do you reach, they're connected, how do you reach the vaccine hesitant and perhaps anti-vaxxers in getting either their second shot if they only got their first Moderna or Pfizer shot and were afraid to get their second one, or if they've gotten no shots? And as if we unfortunately see that we're moving from substantial level of community transmission to the high level, would it be on the table to have mandated vaccines?
Thank you, Nancy. These vaccines are authorized under emergency use, and this has come up a number of times, and they are voluntary. I also want to acknowledge that there are some people that aren't going to get vaccinated, and those people in particular have to do other things in order to protect themselves, and that goes back to keeping your distance, from others, and as well as wearing the mask, which was a requirement throughout this time in terms of being indoors if you are not fully vaccinated, as well as paying attention to your symptoms. And if you are ill, and even for fully vaccinated people, if you're ill and have symptoms that could be COVID, get yourself checked and stay away from others until you're clear that you don't have COVID. So, we do recognize that not everyone is going to get vaccinated, and we accept that. It is a personal decision at this time whether or not you get vaccinated, but it is the most important step you can do to protect yourself from this virus. And you can see this in our data in terms of what we're seeing in cases between those who are fully vaccinated versus those who are unvaccinated. Unvaccinated by far the largest risk of driving the pandemic that we're seeing at the moment. So it is really, something that we recognize. I respect that choice, but I also want you to make an educated decision. Get accurate information in relationship to the risk or the side effects, whatever you're thinking about or you're worried about, and make an educated decision. And if you make a decision to not get vaccinated, make sure you're doing everything you can to reduce your risk, especially at this moment where the transmission in the community has risen to this level. In terms of those who are vaccine hesitant, again, some of the same things in terms of what you need to do. But for those who have gotten their first dose and haven't gotten their second dose, you got your first dose, complete your second dose. That's where you get your protection. If you had, really bad side effects, from the first dose, they did go away, hopefully, and they usually do. And you're worried about having more severe side effects with your second dose, it's something that you may have to contend with. However, the protection that you get from the vaccine far outweighs, what happens if you get COVID, or what could potentially happen if you get COVID-19. But again, people are making their choices. But if you make the choice to not complete your vaccination series or not get vaccinated, take every precaution at this moment and every layer in order to reduce your risk of getting infected with COVID-19. The level of transmission is much higher than it ever was as of July 15th or June 15th.
Thank you so very much. And thank you to everyone for attending today. You may send additional questions to our media inbox at media@ph.lacounty.gov. I hope everyone has a nice afternoon. Spanish remarks will begin at 3 p.m.